So the first thing that we will be doing in parental medication is to check the doctor's order, because the rationale for this is because it's more reliable. Next, the second step is to check the medication into the MAR, or the medication administration record. The third step is to check carefully the label in the EMAR to make sure that we prepare the correct medication. And lastly, organize the equipment that we will be needing. So the rationale for that is to save time and effort. So I will be checking the doctor's order. And I'll also check it into the MAR, or the medication administration record. And I'm also checking the label carefully. So there's actually three steps in administering medication, and we need to follow that. The first one is take note when did you taken when it is taken from the medication cart. The second one is to before withdrawing the medication, and the last one is after withdrawing the medication. So those are the three steps that we need to put in mind in administering medication. So after we organize the equipment, let's perform the hand hygiene and observe the other appropriate infection prevention procedures. So as you can see, I already wear my gloves because I already did the hand washing. So the rationale for that is do not spread any microorganism to the patient, especially to the medication. So prepares the medication vial for drug withdrawal. So these are the things that I will be needing in this assessment. So let's just pretend that this is my vial. Next is the cotton, or the antiseptic wipe, and lastly this is my syringe. So mix the solution or the vial if necessary by rotating vial between the palms of my hand, not by shaking. So this I'll be rotating this between the palms of my hand. So after we rotate this vial, let's remove the cup and clean the rubber cup of a previously open vial with an antiseptic solution or antiseptic wipe. Let's clean this in a circular motion. Next is let's withdraw the medication. So attaches a filter needle as agency practice dictates to draw up premixed liquid medications from multi-dose vials. Ensure that the needle is firmly attached to the syringe. So there will no injury, or will be no accidents that might happen here. Next is remove the cup from the needle. Then draw up to the syringe the amount of air equal to the volume of the medication. Next is carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. So the rationale for this is not to contaminate the vial or the medication. So let's put this one at the center of the vial. Inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So let's just... After we inject the air into the vial, withdraw the prescribed amount of medication using either the following methods. Hold the vial down with the base lower than the top, move the needle tip so that it is below the fluid level, and withdraw the medication. So let's... Invert the vial to ensure the needle tip is below the fluid level, and gradually withdraw the medication. So after we prepare the ampule, let's check the MAR, or the medication administration record. So the rationale for that is to check the we can be able to check or make sure that we prepare the medication correctly. So next is, let's follow the 3 administering steps. Those are read the label before taken, or when taken the medication, before taking the medication, and after the medication. So next is let's organize all the equipment or the materials that we'll be needing, and here are my things that I did prepare. So these are the cotton balls and the syringe with the medication. Next is, let's provide the client the privacy, and also let's prepare him with regards to the side effects and to the procedure that we'll be doing to her. So prior to performing that procedure, let's introduce ourselves and verify the identity of the patient. So hi ma'am, good afternoon. My name is Angela Manta from Davao Doctors College Incorporated. So ma'am, can you state your name and your birthday for verification?
My name is Kate, and my birthday is October 17th.
That's good. And by the way, ma'am, are you all good with your environment? Are you uncomfortable? Just let me know.
Yeah.
You're okay with that. Okay. So after we prepare the medication from the vial, let's proceed on explaining the procedure to the client. Explain to the client that the medication will create or will produce a small wheal, sometimes called a bleb. So a wheal is a small raised area like a blister after we inject the medication. So hi ma'am, good afternoon. My name is Angela Manta, and I am your student nurse for today. I'm actually from Davao Doctors College Incorporated. So for today, ma'am, I will be injecting you. I will be injecting you with your medication that the doctor said or ordered. So for this one, ma'am, we'll do the intradermal injection. So we're going to inject that here, or the skin test, or what we call skin test, ma'am. And after the injection, ma'am, there will be a small wheal or what we call bleb. So this will going to raise, or some of this area, ma'am, will going to raise. Okay, just like a blister. Alright, so after that, after explaining to the client the small wheel, let's provide the client's privacy. Anyway, ma'am, do you have any questions, or do you have anything to ask, ma'am, with regards to your position right now? Are you comfortable, or do you want me? Okay, that's good. That's good to hear. Now, so after we provide the client her privacy, let's select the area or the site that the site. We're going. The selected area will be here. I will going to do the injection here in her area. Prepare the syringe, or the syringe that we will be needing. Here are the syringe for injection and the cotton ball. We're gonna clean this part in a circular motion. Next is we're going to remove the cup, the needle cup, while waiting to dry the antiseptic. Next is expels any bubbles from syringe, small bubbles that adhere to the plunger. After stretching the skin tone at the injection site by pulling gently with the thumb and forefinger at your non-dominant hand. Next is that pull the needle very close to the patient's skin. Insert it slowly at the 5 to 15 degree angle until you feel the resistance. So advance the needle up to the epidermis about 1 to 8 inches or 3 millimeters. A blob that resembles a mosquito bite will appear on the patient's skin. So again, I will be putting this and then I will slowly inject it until I feel the resemblance. Then while encircling the wheel, will be so instruct the watcher or the patient not to rub the wheel or erase the mark. So, next is that other syringe, don't recap the used needle and syringe to appropriate receptacle. Wash hands and do not do documentation of nurses' notes. Request the resident to interpret the result 30 minutes after. So the rationale for this is that to prevent needle. So the first thing that we will be doing in parental medication is to check the doctor's order, because the rationale for this is because it's more reliable. Next, the second step is to check the medication into the MAR, or the medication administration record. The third step is to check carefully the label in the EMAR to make sure that we prepare the correct medication. And lastly, organize the equipment that we will be needing. So the rationale for that is to save time and effort. So I will be checking the doctor's order. And I'll also check it into the MAR, or the medication administration record. And I'm also checking the label carefully. So there's actually three steps in administering medication, and we need to follow that. The first one is take note when did you taken when it is taken from the medication cart. The second one is to before withdrawing the medication, and the last one is after withdrawing the medication. So those are the three steps that we need to put in mind in administering medication. So perform hand hygiene and observe other appropriate infection prevention procedures. So the rationale for that is to not to spread any microorganism to the patient as well as to the medication. So as you can see, I already have my hand washing. I also did my hand gloves. Next is prepare the medication ampule for drug withdrawal. So here are the materials that I will be using. Let's just pretend that this is my ampule. This is the alcohol wipe. This is the tube or the the tube or the filter, and lastly this is my syringe. So first thing to do is flex the upper stem or upper stem of the ampule several times with fingernails. Uses an ampule opener, or let's place this alcohol wipe between your thumb and the ampule neck, or around the ampule neck, and break off the top by bending it toward you to ensure the ampule is broken away from yourself and away from others. So let's just broke this one towards you. So we already break it. And then next is place the antiseptic wipe packet over the top of the ampule before breaking up the top of the top. Dispose the top of the ampule in the sharps container. Next is dispose of withdraws the medication. So places the ampule on a flat surface. Let's place this one. Next is attach the filter needles or the straw to the syringe. So first let's just get this one and then attach it. So after we put the straw or the filter to the syringe, let's place the let's remove the cup from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft. With a single ampule, holds the slightly on its side if necessary to obtain more than the ordered amount of medication. So that's so after that is, if giving an injection, replace a filter needle. And then put it on the... So since we are doing the intramuscular injection, this is the target, or this is the part that we will injecting the medication. So I will be explaining the purpose of the medication and how it will help to the client. So ma'am, the purpose of this will help you, ma'am, with your illnesses or with your disease. Okay, so do you have any questions, ma'am, before we administer the medication? Not so far. Okay, that's good to hear, ma'am. Now I already select the part or the target that I will be injecting the medication, so I will be cleaning that. I will be cleaning this part with alcohol wipes in a circular motion. Just make sure that the selected site is not swelling or it's not tender. So if infections are the frequent alternate sites, avoid using the same site twice in a row. So I already applied the gloves, the clean gloves, and now let's cleanse or clean the selected site with the alcohol swab or alcohol wipes in a circular motion. Next, transfer and holds the swab between the third and fourth fingers on your non-dominant hand in readiness for withdrawal, or position the swab on the client's skin above the intended site. So prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. Let's remove the needle. And we're going to do the Z-track technique. So holding the syringe between the thumb and forefinger as if you're holding a pen, pierce the skin quickly under and smoothly at the 90 angle. Next is holds the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back the plunger with your dominant hand. Aspirate for 5 seconds. Next is, if blood does not appear, inject the medication steadily and slowly, approximately 10 seconds, while holding the syringe steady if using the... So let's inject it. Next is, after injection, wait 10 seconds if using... Withdraw the needle smoothly at the same angle of insertion. Applies gentle pressure at the side with the cotton. Next, if not necessary, it is not necessary to massage the area at the site of injection. If bleeding occurs, apply pressure with a dry sterile gauze until it stops. So for this injection or the syringe, we're going to dispose this on the sharp trash or removes and this. Next, after that is removes and discard gloves and perform hand hygiene. So the first thing that we will be doing in parental medication is to check the doctor's order, because the rationale for this is because it's more reliable. Next, the second step is to check the medication into the MAR or the medication administration record. The third step is to check carefully the label in the EMAR to make sure that we prepare the correct medication. And lastly, organize the equipment that we will be needing. So the rationale for that is to save time and effort. So I will be checking the doctor's order. And I'll also check it into the MAR or the medication administration record. And I'm also checking the label carefully. So there's actually 3 steps in administering medication, and we need to follow that. The first one is take note when did you taken when it is taken from the medication cart. The second one is before withdrawing the medication, and the last one is after withdrawing the medication. So those are the 3 steps that we need to put in mind in administering medication. See the subcutaneous. Next, after validating or after checking the doctor's order, explain to the client how she can participate during this assessment, as well as introduce yourself and verify the client's identity. Provide also the opportunity to raise any concern or ask for any clarification. Hi sir, good day. My name is Caslan G. Lumanta, and I am your student nurse for today. So today's assessment, sir, is that I will be performing a subcutaneous medication. So I will be administering a medication into your body, sir. So anyway, sir, what's your name again? May I have your name, please?
Sean Christopher Morales.
Thank you so much, sir. Anyway, do you still have any questions, sir, with regards to our assessment?
No.
Alright, thank you so much again, sir, for that. So again, after this, sir, I will be performing the procedure right away. Okay, thank you. So next, we're going to inject do the subcutaneous medication. Let's inject now the medicine. So first is grasp the syringe in your dominant hand by holding it between your thumb and finger. Next is with palm facing on the side or upward for 45-degree angle insertion. With palm facing to the side or upward for 45 angle insertion, using the non-dominant hand, pinch or spread the skin at the side and insert the needle using the dominant hand and a firm steady. So for 45 degrees. Next is when the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the non-dominant hand at the plunger. So inject the medication by holding the syringe steady and depressing the plunger with slow, even pressure. Next is remove the needle smoothly, pulling along the line of insertion while depressing the skin with your non-dominant hand. Next is, if bleeding occurs, apply pressure to the site with dry, sterile gauze until it stops. Discard the needle.